And my distinguished colleagues, my name is Senator Ned Nwoko. I represent the good people of Delta North, Delta State. Mr. President, this is a motion for the second reading of the bill for an act to establish the National Agency for Malaria Eradication, NAME. I rise today to lead the debate on a bill for an act to establish the National Agency for Malaria Eradication. This bill, which was first read on Tuesday, November 28, 2023, now appears before this chamber with a revised title and a sharpened focus, because what it seeks to address is nothing short of a national emergency. Mr. President, according to the World Health Organization's report 2024, Africa records approximately 6,000 malaria deaths annually. Alarmingly, Nigeria accounts for over 184,000 of these deaths, the highest burden globally. Beyond the statistics, this translates to families devastated, futures aborted, and national productivity diminished. Malaria is not merely a public health issue. It is a structural crisis that impairs maternal health, drains economic productivity, and impedes national development. It accounts for approximately 11% of maternal mortality in Nigeria, contributing to severe anemia, miscarriages, stillbirths, infant deaths, tragic outcomes that disproportionately affect our most vulnerable citizens. Distinguished colleagues, economically, malaria bleeds the nation through the loss of millions of man-hours each year. Entire sectors experience drops in efficiency. Business absorb avoidable health-related costs, and our national output is compromised simply because we have normalized what would have never been normalized. This normalization is the root of the problem. If malaria were endemic to Europe or North America, we would not have been grappling with it a century later. Mr. President, COVID-19 showed us what is possible when the world mobilizes against a health crisis. In mere months, vaccines were developed, global funding was unleashed, and containment protocols deployed. By contrast, malaria, despite centuries of devastation, continues to receive tepid responses and fragmented interventions. As a private citizen, distinguished colleagues, I've taken bold steps through my foundation to mobilize advocacy, promote research, and initiate high-level consultations, including hosting a strategic WHO meeting in my village to shape a Pan-African strategy. But these efforts, however well-meaning, cannot substitute for structural national action. Mr. President, my distinguished colleagues, the current health architecture is insufficient. The National Malaria Elimination Program, NMEP, is a policy-based but underpowered. The National Health Development Agency, NPHCDA, delivers care but lacks scale and support. The National Center for Disease Control, though stellar during COVID-19, is peripheral in malaria matters. Even the Presidential End Malaria Council, though well-conceived, lacks legislative anchoring and executive muscle. The bill proposes a centralized, autonomous, and fully resourced national agency for malaria eradication. Its mandate will be clear and aggressive. Formulate and champion national policies for malaria eradication, coordinate interagency and sectoral responses with authority, mobilize and manage resources efficiently and transparently, invest in and support vaccine research, including genetic innovation, being explored globally. Implement routine vector control operations, including nationwide fumigation to eliminate breed sites, interrupt malaria spread, and achieve zero local transmission. Distinguished colleagues, Nigeria cannot come to lead the world in malaria deaths. Our vectors are evolving, our parasites are adapting, so must our institutional responses. A fragmented structure cannot confront a mutating threat. We need a unified, science-driven, and legislative-backed institution with a singular mandate to end malaria in Nigeria. Mr. President, the time has come for this nation to demonstrate the political will, urgency, and resolve that malaria eradication demands. Let this bill be our collective legacy. A line in the sand, marking the point where Nigeria stood up, not just to treat malaria, but to end it. I urge you, Mr. President, and my Zoom colleagues to support the speedy passage of this bill as a critical step towards saving lives, strengthening our public health infrastructure, securing health future of our nation. I so submit, Mr. President. Thank you.
Senator Victor Ome.